Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So, today I'm going to tell you about hypertension and its management. So, hypertension is defined as persistent high BP. Clinically, when the blood systolic pressure remains elevated above 150 mm of Hg and diastolic remain above 90 mm of Hg, then it is considered as hypertension. If there is only increase in systolic pressure, then it is systolic hypertension. So it could be of two types, primary and secondary. Primary means there is high BP without source or associated with any other disease. The arterial BP is increased because of increased peripheral resistance due to any cause. Risk factors are hereditary, obesity, mental tension, or smoking. So 90 to 95 percent of people suffer from this kind of hypertension, most common type of hypertension. Secondary is due to means it is associated with any other disease like kidney disease, or it could be cardiovascular hypertension. Like in case of atherosclerosis, there's hardening of blood vessels, and it could be due to cardiac stenosis. Endocrine hypertension means there is excess secretion of aldosterone from adrenal cortex, like hyperaldosteronism, Cushing syndrome, excess secretion of glucocorticoids. Then renal hypertension. Uh, it could be due to compression of renal artery or branches, which could be of further two types, like in which the one is one kidney gallbladder hypertension, in which one kidney is already moved, and renal artery of other is constricted due to any reason. And second is artery to one kidney is constricted while to other is normal. Next is neurogenic hypertension. So nervous disorders which produce hypertension, like it could be due to increased intracranial pressure, lesion in tragus solitaris. So what are the causes? Some are genetics, family history, environment, inactivity, stress, obesity. There's so many causes like tobacco usage, menopausal medications, or high sodium diet or age. So this is the classification of BP in adults having age more than 18 years. So normal systolic and diastolic is given. Then prehypertensives are 120 to 139, diastolic 80 to 89. Then stage 1 is 140, 159 and diastolic 90, 99. And stage 2 is more than or equal to 160 and diastolic is 100. So BP is measured twice, first with patient supine and then seated. Then patient has been standing for more than 2 minutes on 3 separate days, and then average of the measurement is used for the diagnosis. So what are the clinical features? It can cause transient headache. Long hypertension can lead to left ventricular hypertrophy. What are the complications of hypertension? It could be transient ischemic attack, stroke, subarachnoid hemorrhage. It could be hypertensive encephalopathy, in which there is very high BP, neurological manifestations like there could be disturbance in vision, speech, there could be paresthesia, fit, loss of consciousness. So these are usually reversible symptoms with BP control. Other complications like there could be ophthalmic complications, means there could be retinal arterioles thickening, there could be retinal hemorrhages, papilledema, there could be angina, there could be left ventricular failure, aortic aneurysm, renal complication like proteinuria, progressive renal failure, then malignant hypertension, which is a clinical syndrome in which there is very high BP and renal hemorrhage. Like one could come with confusion, headache, vomiting, etc. And how we can manage hypertension in athletes or physically active patients. So there are many risk factors for hypertension in athletes and the physically active patients. Like it could be due to high sodium intake, alcohol consumption, or any drug usage like cocaine, steroid usage, stimulant use, high stress level, males, gender, race, family history, diabetes, or smoking or tobacco usage, obesity. So these are some of the risk factor. If these risk factors can be controlled, then we can manage the hypertension effectively. So, what are the exercise and sports participation in athletes and other active persons? Like it could be due to fit principle, like recommended mode, frequency, duration, intensity of exercises, Like for sports one, it's important to control before resumption of participation in any vigorous sport. Both dynamic and isometric exercises can cause a BP increase, and recommendation on exercise restriction like high normal BP, there will be no restriction. Control mild to moderate. Uh, One can limit on isometric training and uncontrolled limit to low intensity uh, dynamic exercise and avoid isometric. Uncontrolled then limit to low intensity. Severe hypertension limit to low intensity exercises, and then also one can participate if BP is under control. Secondary hypertension, then one can definitely limit to low intensity, and collision sports that could lead to kidney damage should be avoided by the athlete. Thank you.